So welcome, Father Mathew. Thank you for sharing your stories with us from Chai in the south of India. As you know, we are very interested in hearing your experiences. And first, we would like to ask you, what were the biggest problems for children with disabilities and their families that you saw in your working areas that were affected by COVID?
So, when it comes to insufficient food and nutrition, this happened in both the waves. And in the first wave, this was very much affected because there was a sudden lockdown and a loss of livelihood for the parents. So they could not support the family. So what we did is, with the help of several funding partners, including Liliane Funds, we provided supply of food and hygiene kits for these families affected with children with disability, and that support was given for about 6 months. And in case of emotional distress, this happened because many of them were suddenly confined at home and they had limited access to therapy, medicines, education, recreation, and insufficient food and nutrition. So that is what resulted in emotional distress among these children with disability and their families. So in that case, our intervention was mostly online counseling and support because visiting these families were very difficult, especially in the first wave when there was strict lockdown. But in the further wave, second wave, we could visit and counsel these families with the help of the CBR workers. Now, when it comes to deterioration of disability condition, many of these children could not access therapy and medicine. So that actually affected their condition. And this is where we intervened through digital reach. So our therapists could reach to these families through the digital mode and guide the family members or caregivers, or sometimes even involve the CBR workers. Another problem was, as I mentioned, loss of livelihood. Most of these parents of these disability children or youngsters are daily wage workers, and many of them lost their jobs. So here, what we did, we got them assistance. We helped them, or we gave assistance in getting government rations, pensions, and social security support. And regarding loss of access to education, um, it happened because the regular and the special education schools were closed, so children could not go to the schools. This is where we intervened through home-based online education, again through online methods. When it comes to lack of transportation for emergency services, this happened because of the lockdown restrictions. Um, the authorities were not allowing them to vehicles because of lockdown, especially in the first initial wave. And some of the private transport people were utilizing or exploiting the situation by overpricing their charges. So what we did, this is where the MIVA vehicles were of much support because many of them were considered as ambulances, and we could use get special permissions from authorities to use these MIVA supported vehicles to help our children with disability to access emergency services. Now, we also had problems with inadequate hospital beds, ICU beds, and oxygen, especially in the second wave. Here, we used the Catholic Healthcare Network to provide referral services. And we also used the government and other facilities, healthcare facilities, to facilitate hospitalization whenever required for these children. Right now, we have a problem of vaccine hesitancy and availability of vaccine. So this is where we are also helping through our CBR workers um, to spread vaccine awareness and also to give support for them to go to the vaccine centers and get vaccinated. We also promote COVID appropriate behavior awareness so that they are protected from getting COVID. I can conclude with two case studies. to concrete case studies. We have one 13-year-old girl called Roma Baburao Kole in Maharashtra, who she is having a locomotor disability. Her brother is also having Rupesh. She is also having disability. Their father died when they were young, and the mother is the only one who were taking care of them. She was working as a maid in different houses. So during this COVID time, Roma got fever, and all the primary health centers around were filled with corona patients, and it was very risky to take her to this place. And the nearby hospital was a bit far away, where she could safely go, and no vehicles were available. So Sankley Mission Society, one of our partner organizations, provided the MIVA supported, MIVA LF supported vehicle, and that way we could take her safely and bring her back, when she was in a difficult, going through a difficulty. Another case study I could share with you is about Jivan Shu. This is a 16-year-old teenager with intellectual disability. His father was the only earning member, breadwinner of the family, and during this lockdown period, he lost his livelihood. So, our partners knew that Jivanshu was interested in animal husbandry. So, we did some direct advocacy with the government, local government, on livelihood issues. And the government initiated a project where, through the panchayat, Jivanshu was given an opportunity to work on animal husbandry, take care of animals for his livelihood. And today the family makes a living out of this project for Jivanshu. I think there are several case studies like this. So these are some of the examples probably may be helpful